If you are around 60 or 65 years old, or even older, then including the right nuts in your diet can support your heart health, help you manage diabetes, strengthen your bones, and even improve your memory and brain function. In India, nuts are mostly referred to as dry fruits. For example, almonds, walnuts, cashews, and pistachios are all actually nuts. But in common language, we call them dry fruits. Both Ayurveda and modern science agree that nuts are very beneficial for health. But as we age, the body's needs change, and its ability to process food also declines. This means that after the age of 60 to 65, if you eat the wrong dry fruits, the very same ones that once benefited you may now harm your health. In today's video, we will learn about the 4 best and 4 worst nuts for senior citizens, so that you or the seniors in your home can make the right choice. So let's not waste any time and begin with the 4 best and 4 worst dry fruits for seniors. The first nut that is extremely beneficial for you is walnuts. Walnuts contain a plant-based omega-3 fatty acid called ALA, which is excellent for heart health. It reduces inflammation in the body and helps keep the heart and blood vessels healthy. A study on walnuts shows that eating about 1 ounce, around 28 grams, of walnuts daily reduces artery inflammation to the same extent as olive oil. And when inflammation in the arteries goes down, the risk of plaque buildup and blockages also decreases. Ultimately, this lowers the risk of a heart attack. When it comes to brain health, regular consumption of walnuts improves memory and cognitive function in senior citizens. The second best nut is almonds. Friends, eating soaked almonds in the morning helps heal the heart, strengthens bones, and keeps the brain sharp. Almonds contain monounsaturated fats, the same healthy fats that help improve cholesterol levels by lowering LDL, the bad cholesterol that clogs arteries. This ultimately reduces the risk of heart disease. Ayurveda also supports these benefits of almonds. Specifically, soaked almonds are highly recommended in Ayurveda for memory, energy, and overall vitality. In short, almonds protect the heart, strengthen bones, and support brain function. The third nut is peanuts. Technically, peanuts are not nuts, but legumes belonging to the lentil family. But since most people consider them nuts, we've included them in this list. Peanuts are a simple and affordable option, not only tasty, but also very beneficial for health. They contain protein, healthy fats, and folate, vitamin B9, which is important for brain health and good memory. This is especially helpful for seniors who are more at risk of neurological issues. Peanuts also provide vitamin E and an antioxidant called resveratrol, which supports heart health and improves blood circulation. But one important thing to remember: always eat roasted or boiled peanuts without excess salt or spices. The spicy or packaged versions, like nutcracker peanuts, won't give you any benefit. In fact, they could harm you. The fourth best nut for seniors is pistachios. Pistachios contain potassium and phytosterols, both of which are beneficial for the heart and body. Compared to other nuts, pistachios have a lower protein-to-calorie ratio, meaning you get more nutrition with fewer calories. In fact, research has shown that eating pistachios can also help with weight management. It can even help shrink your waistline, that is, reduce belly fat. Pistachios are also excellent for heart health, helping to lower LDL, the bad cholesterol, as well as blood pressure. Not only that, if you have diabetes, pistachios can also be helpful in managing it. In a 9-month trial, researchers found that adding pistachios to the diet reduced fasting blood sugar levels and significantly improved insulin sensitivity. And here's the interesting part. A Turkish study showed that eating pistachios improved blood flow, and in some men, it even improved erectile function. As men age, erection problems often occur due to stress or reduced circulation, and pistachios may help with that too. Friends, apart from these 4 nuts, there are several other nuts that are highly beneficial for senior citizens. 2 of them are worth a special mention here: hazelnuts and Brazil nuts. In addition, foxnuts, commonly known as macana in India, are technically seeds, but they are usually considered dry fruits in everyday language. These are also very beneficial for seniors. So if you want, you can include hazelnuts, Brazil nuts, and macana in your diet as additional healthy options. Now that we've talked about the best nuts, let's move on to the 4 nuts that seniors should avoid in old age. The first is betel nut, commonly known as supari. Friends, betel nut is not a regular edible nut, but many elderly people in India chew it daily with pan or consume it in pan masala. Chewing betel nut carries serious health risks. The World Health Organization has clearly declared it a carcinogen, meaning it can cause cancers of the mouth and throat. It also leads to gum problems, tooth decay, and unsightly red stains on teeth. But the harm isn't limited to the mouth. Supari also negatively affects the heart and metabolism. Studies show that regular use increases the risk of heart disease, metabolic syndrome, and even obesity. Betel nut works like a stimulant, which raises both blood pressure and heart rate, something very unsafe for heart patients, especially seniors. The second category to avoid is salted or fried nuts, basically packaged or branded nuts. While natural nuts are healthy, the most unhealthy ones for seniors are heavily salted, sugar-coated, or deep-fried nuts. They may taste great, and the labels often say natural or healthy, but in reality, they're harmful. Even simple peanuts become dangerous when deep-fried and loaded with salt or spices. Extra salt raises blood pressure, increasing the risk of heart attack and stroke. Packaged nuts like roasted salted cashews, masala peanuts, honey-coated almonds, etc., usually contain excessive sodium and sugar. Frying nuts in oil also adds unnecessary saturated fats, trans fats, and calories. So always make sure you buy raw or dry roasted nuts without added spices, salt, or coatings. The third nut seniors should avoid is cashews. Cashews are a favorite in India, but seniors should limit or avoid them. Cashews are high in saturated fat. About 20% of their fat content is saturated. For this reason, early U.S. health regulations didn't classify cashews as heart-healthy like almonds or walnuts. The good news is that most of the saturated fat in cashews is stearic acid, which has a neutral effect on cholesterol. It neither raises nor lowers it. Still, since cashews are calorie-dense and often overeaten because of their taste, it's best for seniors to avoid them. Cashews also contain oxalates, which can be problematic for seniors with kidney stones or diabetes. The fourth and worst nuts are macadamia nuts and pecans. Although these aren't very common in India, globalization has made them available in high-end stores and imported cookies. They are buttery and delicious, but that rich taste comes from very high fat content. Just 1 ounce of macadamia nuts contains about 200 calories and more than 20 grams of fat, much higher than most other nuts. A CBS report even listed macadamias and pecans among the worst nuts for your diet. On top of that, they are usually sold in salted or chocolate-coated forms, which further increase calories, sugar, and sodium, all harmful for health. So friends, these are the 4 best and 4 worst nuts for seniors. If you liked this video, don't forget to hit the like button. If you're new to the channel, make sure to subscribe. And if you have any questions in mind, feel free to ask in the comments. Keep smiling, keep learning something new every day, and stay healthy always.